Hi, everybody. I'm Ilan Meyer from the Williams Institute, and we're here for our webinar on victimization of sexual and gender minorities in the United States. We have really exciting presenters, and before we get to that, I would like to ask our interpreter, Eliza, to explain for the Spanish-speaking audience how to proceed. Okay, for those of you who are on the English channel, you should be able to hear me now in English. And thank you again, Elisa will be providing the Spanish translation. As I said, we're here to discuss our research on victimization of sexual and gender minorities in the United States. We have three presenters who will talk about some of the research finding from our study. And we have a special guest. Ericka Dixon is the manager of training programs at New York City's Anti-Violence Project, and she will be our discussant to help us think about the findings and the broader implications for our communities. And after that, we will also have some time for questions and answers. The presenters today in order will be Lynn Langton, who is a senior research criminologist at RTI International. Research Triangle Institute is a research center. Andrew Flores, who is a visiting scholar at the Williams Institute, and Jody Herman, who's a scholar of public policy at the Williams Institute as well. Those of you who would like to ask questions, there is a Q&A link at the bottom of your screen, should be at the bottom of your screens, and you're welcome to add questions there, and we will get to them at the end. If I see that there is any question that is pressing that has to do with clarifying something, I might ask the presenters to explain that. But other than that, we will do the questions and answers and discussion at the end of the presentations. So we have plenty of time, and we are going to have a very relaxed presentation, so we can follow everything, and we do have some slides, of course. So with that, I'm going to turn the floor to Lynn, who will start by talking a little bit about the Ncbs, the data set that became available for the first time, and that we will present findings from that database. So Lynn? Lynn, you have to unmute.
Happens every time somehow. Thank you, Ilan. Thank you all for joining us this afternoon or evening if you're on the East Coast like I am. As Ilan mentioned, I'm a senior research criminologist with a phenomenal research organization called RTI International. But before I took on this role about 2 years ago, I was actually chief of the Victimization Statistics Unit at the Bureau of Justice Statistics, overseeing the National Crime Victimization Survey, which is the source of data that we're going to be talking about today. So I'm going to kick us off by giving a quick overview of the NCVS, what it measures, and why it's important that it became one of the first surveys from a federal statistical agency to collect data on both sexual orientation and gender identity. And then from there, my colleagues will talk about the more interesting stuff, which is what the actual data tells us about the victimization experiences of sexual and gender minorities in this country. So the NCVS is one of the two principal measures of crime in this country. It was developed to serve as a counterpart to the FBI's Uniform Crime Reporting Program, which is the other key measure. The FBI's crime statistics are based on crimes reported to law enforcement agencies around the country. And even back in the 60s, when the NCVS was being conceptualized, there was recognition that many crimes were not going to be reported to the police for a variety of reasons, and even that police data could be manipulated. So there was a need for an independent source of crime data that could address what we call the hidden figure of crime, or those crimes that never come to the attention of the police. And the NCVS was essentially developed to address that need. The survey has been in the field continuously since 1973, though it has gone through a few changes and one major redesign during that period. The way the survey works is that the Census Bureau, who conducts the survey for the Bureau of Justice Statistics, selects a nationally representative sample of households across the United States, and then interviews all persons over the phone or in person, ages 12 or older within those households. The NCVS is a longitudinal survey, meaning that once a household is selected to be in the sample, that household is in the sample for 3 years and is interviewed every 6 months over that 3-year period. Conducting this survey is a major undertaking with nearly 250,000 interviews conducted annually. In terms of the content of the survey, interviewed persons are asked about their experiences with crime, both those that are reported to the police and those that aren't reported to the police in the prior 6 months. And the survey covers 8 key crime types, which you see here on the screen. So it covers the violent crimes of rape and sexual assault, robbery, aggravated assault, and simple assault, and the property crimes of personal larceny, burglary, motor vehicle theft, and other theft. You see like a slightly lighter blue shading here, and that indicates those crimes that are measured at the household level versus the person level. So in other words, looking at motor vehicle theft, for example, only one person in the household is asked about motor vehicle theft, and they answer for the whole household, so all the persons living within a particular residential unit as a whole. And then individuals who report experiencing any one of these crimes are also asked about the details of each incident. So that includes things like their relationship to the offender, whether the incident involved a weapon, whether they sustained an injury and sought medical treatment, whether it was reported to the police, and then a number of other questions about the impact that the victimization experience had on their lives. In addition to questions about experiences with victimization and the characteristics of the incidents, the survey also captures extensive information about the characteristics of respondents. And here on this slide, you can see some of those characteristics. Most importantly for our discussion today, in July of 2016, the NCVS demographic questions were expanded to include several additional characteristics known to be correlated with victimization, including sexual orientation and gender identity, which were added for respondents age 16 or older. So in July of 2016, this major national crime survey became one of the first federal surveys to ask both sexual orientation and gender identity. And these were really important additions because a number of smaller studies have previously identified SGM status as a predictor of victimization risk, but we really didn't know the full extent to which this was the case nationwide. And so we needed to be able to collect these data through a large national survey to understand the full extent of the problem. So I'm going to show you here the actual questions that the NCBS uses to measure sexual orientation and gender identity. Here we have the sexual orientation questions. These were modeled after questions that were already asked on the National Health Interview Survey, and they're focused on sexual identity versus, say, sexual behavior. And you can see here that the wording is slightly different depending on whether the respondent is identified as a male or a female. The gender identity question, so the gender identity measure, uses a two-step approach. So first, the questions ask about sex assigned at birth, and then current gender identity. And this enables a person to identify as either male or female rather than as transgender, but they can still be classified as transgender if their current gender identity is different from their sex assigned at birth. So they could identify as transgender, or they could just identify that their current identity is different from that assigned at birth. And either way, they would be classified. And I should note that both these questions here and the sexual orientation questions that I mentioned previously were derived from other surveys, but even still, we did extensive testing on them before they were added to the NCBS, and that's testing both in English and Spanish. And that included things like doing cognitive interviews with victims, conducting focus groups, using debriefing questionnaires, both for respondents and interviewers, and conducting targeted follow-up interviewers with people who responded to the questions. So all of those testing activities were designed to really ensure that these are good measures that are capturing the intended constructs. So that was an extensive and lengthy process prior to these being put out into the field. So before I turn it over to my colleagues to talk about the findings from our studies, the one thing I want to mention is that unfortunately, there's now a big limitation to these data and how they can be used. The Trump appointed BJS director, who now has about 3 more days in office, came in and essentially took a hacksaw to the gender identity and sexual orientation questions, despite valiant efforts from many groups and organizations working on these issues, including the Williams Institute. But for really no justifiable reason, beginning in 2019, the sexual orientation and gender identity questions were changed to be asked only of victims instead of all respondents, and to be asked only one time during the 3-year period that an individual would be in the sample. So this means that many of the estimates, the findings that Andrew and Jody are going to share with you, can no longer be generated with the survey data. And even more importantly, that it won't be possible to examine respondent SGM status in conjunction with any of the supplemental surveys to the NCBS that we're not even talking about today. Those are surveys like the Police Public Context Survey, which collects data on resident interactions with police and perceptions of those interactions, and will no longer be able to look at SGM status in correlation with those supplemental surveys. So that's the pitch. As soon as the Bureau of Justice Statistics gets a new director, it'll be important to communicate to him or her the need for these data and for going back to asking the questions of everyone age 16 or older, so that we can continue to examine findings like Andrew and Jody are going to be talking about. And with that, I will turn it over to Andrew.
Making sure the screen share.
Andrew,
I'm here.
we have a question about does the system allow somebody to mark multiple boxes, i.e. female and transgender? I'm pretty sure the answer is no, but Lynn, can you? No. Yes, it doesn't.
Sorry, I was actually just double checking by looking at the instrument, and the answer is no, it does not.
Okay. And also a question, what if the person identifies non-binary? And I think Andrew might be able to address that when we get to the description of the population. So thank you, Lynn, and we're moving to Andrew now.
Thank you, Ilan. So I'm just going to present some findings from the Ncbs, largely from the 2017, but then some of the results that myself and Jody will present will also be of the 2017 and 2018 combined surveys. So anyways, my name is Andrew Flores. I am an assistant professor at American University and also a visiting scholar at the Williams Institute. First, to describe a little bit of the estimates of just the prevalence of LGBT people and people who are transgender in the Ncbs. So around 2% of the sample is LGBT in the Ncbs, which with other government's federally sponsored surveys is rather consistent with other prevalence estimates that others have produced. Though I will also note that it is slightly lower than, say, other estimates that have been produced from non-government or non-federally sponsored government surveys. And here, this is just the weighted percentage breakdown between LGBT and heterosexual respondents, and then subdivided by different sexual identity categories and gender identity categories. And then the associated sample size. So these are just the number of respondents in the sample. And that number is just not weighted. And so we could see that about 2% is LGB, with a significant portion of that comprised of gay men, lesbians and bisexual women, and that bisexual men have the smallest portion of the LGB group. And then we can see a relatively even distribution in terms of heterosexual women and heterosexual men. For gender identity, we see that about 0.1% of the sample is transgender. And this is individuals who identify as currently as man or woman, but have a current gender identity that is different from their assigned sex at birth, or individuals who do not identify as man or woman, but only identify as transgender. And for the respondents, to clarify what Ilan was saying, for respondents who did not indicate their current gender identity was man or woman, and just indicated transgender, that is that category of non-binary that is in that table right there. There were other respondents, as the questions explained, where some individuals did not identify as LGB or as straight, and they selected other. And then for the gender identity, there might be those who preferred not to answer the question as either man, woman, or transgender. And we're not going to be presenting findings on the people who kind of refused to answer these questions or said that there was some other category, though we do document in our research findings, and I'm sure that we'll be linking to the paper, those results for those individuals. And the reason why we're not presenting those here today is that we don't know, we have not had, like, I guess, a sufficient motivation to kind of unpack theoretically the experiences of those who select something that is other or unknown. And we didn't find in our findings kind of consistent or unique patterns for those groups in terms of the demographics, but then also in terms of victimization. Moving forward. Just a quick little summary of demographics. We see a relatively even gender split between LGBT and non-LGBT people. And the racial ethnic composition of those who identify as LGBT is rather similar in the NCBS to those who are not LGBT. But we do see a distinctive pattern in terms of age. People who are LGBT tend, over half of those individuals are in the age category of 16 to 34 years old. And you can see that a big difference between the non-LGBT and LGBT people in 50 years or older. And so you can see that about 44% of non-LGBT people are age 50 or older, compared to only 28% of LGBT people. The only other really interesting pattern in these data that, that I might want to highlight is that LGBT people tend to be more in urban and suburban areas in the NCBS, and slightly less in rural areas as compared to non-LGBT people. So Lynn summarized the victimization types rather well, so I won't spend too much time on this slide. But the NCBS does document victimizations that are personal violent victimizations, as well as property victimizations. And then there are subcategories within those personal violent victimizations that include instances of serious violence as compared to simple assault. A simple assault would be something that is an attack, attempted attack, or verbal threat to attack a victim that does not involve a weapon and that results in a minor injury with less than 2 days of hospitalization. Anything that is not that would be considered an act of serious violence. And serious violence can be subdivided to these different categories of rape or sexual assault, robbery, aggravated assault, and instances of violence that involve a weapon. And then property victimizations, as previously discussed, is about household burglary, motor vehicle theft, and other types of theft. We'll be presenting for you victimization rates. And so victimization rates are estimates, they're estimated by dividing the number of victimizations that occur during a specific time by the population at risk for those victimizations and multiplying by 1,000. So, so this would be like if you have a rate of say 71, which is what we'll be showing, 71 victimizations per 1,000 people. That would be 71 victimizations that occur for every, say, 1,000 LGBT people in the United States. And so here are our primary findings. So here we're just comparing LGBT to non-LGBT people, and these are the victimization rates for different types of crime. So overall, for personal violent victimization, we find that there have been that the victimization rate for LGBT people is 71.1 victimizations per 1,000 persons, as compared to the victimization rate for non-LGBT people, which is 19.2 victimizations per 1,000 persons. And so you can see that there's this large gap between these two estimates. Those lines that are around those estimates are just our confidence intervals. And what we see across numerous types of crime is a significant difference and disparity between LGBT and non-LGBT people. And so this difference between 71 and 19 is significantly different and is significantly large. The victimization rate is for just total violent crime is 4 times that for LGBT people as compared to non-LGBT people. And if you look at different types of violent victimization, from serious violence, rape or sexual assault, aggravated assault, and incidents involving a weapon, you see that there is still significant disparities where LGBT people have higher victimization rates. The only area where we did not find in a statistical sense, a significant difference are in the victimization rates for robberies. On this slide, we're showing you the relationship between the victim and the perpetrator in these incidents of violent crime. And here, the major takeaway is that the data suggests that LGBT people are more likely to know their perpetrators and know them well. And so here, when we say well-known, this includes intimate partners, relatives, or other close friends or people that that people may know well. And then there are casual acquaintances, which are, you know, people who you only say like hello to on a routine, on a somewhat regular basis. And then there are perfect strangers. And while we do see significant disparities, say between well-known relationships and perfect strangers, the disparity is larger for people who LGBT people know well. And we see, again, significant disparities in LGBT people's experiences of rates of intimate partner violence, as well as other relationships. This figure is slightly more complicated, so I will walk you through it. So here we're breaking down sexual orientation identity by gender. And these results are coming from the 2017 and 2018 Ncbs. And so green points are for heterosexual or straight respondents. The orange points are for gay or lesbian respondents, and the purple is for bisexual respondents. And the major takeaway from this slide is that one is that the victimization disparities is largest for bisexual women, and is followed by bisexual men, and that the gaps are slightly smaller for lesbians and gay men, though the disparities still exist. And so you can see for bisexual men, the rate of violent victimization is 76.7 victimizations per 1,000 persons. For gay or lesbian, or for gay men, it is 38.6 victimizations per 1,000 persons, and for heterosexual men, 19.4. And among women, bisexual women, it's 189 victimizations per 1,000 persons, 78.4 per 1,000 persons for lesbians, as compared to 21 victimizations for straight women. And you can see that these disparities kind of persist across different types of crime and victimization. And now I'll pass it over to Jody.
Thank you, Andrew, and thank you for explaining some of the definitions and concepts that will apply to this paper as well. Let me share my screen. My name is Jody Herman, and I'm a scholar of public policy at the Williams Institute, and I'm a co-author along with my co-presenters this evening on this paper. This is a study of the victimization of trans individuals and how that victimization compares to the experiences of cisgender individuals. And we also looked at differences in perceptions of hate motivation for experiences and police reporting. So as Andrew previously mentioned, we needed to combine the 2017 and 2018 Ncbs data for this paper. This allowed us to have an adequate sample for more specific analyses for the trans population. We had a final sample of about 420 trans individuals for this study. So that limits some, more complicated analyses, but we were able to do what we could with that sample. So I wanted to give a little bit of a background. So Prior research has shown that trans people report experiencing a high prevalence of violent victimization. One example of prior research is the 2015 US Transgender Survey. It's a large national non-probability sample. We had about 28,000 respondents. And the survey asked about different kinds of experiences with victimization, but particularly in the past year, which is more analogous to the Ncbs. 9% of respondents reported experiencing physical attack in the past year, 10% experienced unwanted sexual contact, including sexual assault, and 24% had ever experienced severe physical violence by an intimate partner. There are a lot more findings that you can find in the report. It's available online and is several hundred pages long, so it's very detailed. But the US Trans Survey also asked about experiences in comfort with police, which is a topic that's also covered in the Ncbs. And of those who interacted with police in the past year, 58% reported being mistreated by police, and 57% said that they would feel uncomfortable asking the police for help when needed. Our study that I'm presenting tonight differs from the US Trans Survey in that it comes from a nationally representative sample, and it allows us to compare some of these experiences with cisgender respondents who responded to the same survey. However, as you will see, we do find some expected trends based on this type of prior research. I'll mention a bit about the demographics of the sample before I get into the findings. So trans individuals were pretty much similar to cisgender people demographically, except for trans people were overall younger and more likely to have never been married. More likely to reside in urban settings, and more likely to live in a lower income household. So you can see here that trans people report higher rates of personal violent victimization. So trans people overall, these are the rates, these are presented in rates like Andrew mentioned. So trans people overall had a rate of 86.2 personal victimizations per 1,000 persons, and cisgender people overall had a rate of 21.7 personal victimizations for 1,000 persons. So these rates are significantly, for trans people, are significantly higher than for cis people, which is indicated by the little whiskers on the bars in the chart, which are analogous to the lines that Andrew had on his figures. Trans women did not have a significantly higher rate, but a larger sample would allow for more precision in these estimates, because you can see the whiskers are rather wide for the trans sample. In terms of property victimization rates, we identified households that had trans individuals living in the households. And so that's what transgender households means here. And you can see here once again that trans people have a significantly higher reported rate of property victimization per 1,000 persons, except again in the case for households in which a transgender woman lives. We have to do a little bit more thinking as to understand exactly what this means. We do know that trans people in this sample were more likely to live in lower income households, but when controlling for that aspect in a supplemental part of the study, it seems to, these findings seem to hold up. And Andrew can confirm if that's correctly stated. But we can see that property victimizations here are higher for transgender households. In regard to reporting to police, it's interesting here to me, it seems like a counterintuitive trend that transgender individuals had point estimates that were slightly higher in reporting to police than cisgender individuals. So in terms of personal victimization, 51% of transgender individuals reported to police and 47% of cisgender individuals reported to police. However, these differences were not statistically significant. So from a statistical perspective, we don't really see a true difference here between the groups. But I will mention that overall, it's pretty low. So for property victimization, you know, around a third or less individuals are reporting to police those types of victimizations, and personal victimization, you know, less than half, generally speaking, are reporting to police. And this kind of maps onto what we saw in the US trans survey overall, that, you know, over half of trans people would be uncomfortable reporting to police if they needed the police. I should also mention here that we asked, the Ncbs asks about whether individuals attribute their experiences to a hate motivation. And trans people were more likely to report that their personal and property victimizations were hate motivated, but those differences were not statistically significant except for trans women. So trans women had a significantly higher prevalence of reporting a hate motivation for their experiences compared to cisgender women. So though trans women weren't significantly higher in their reported rates of personal victimization, they were significantly higher in reporting that their experiences of personal victimization were due to a hate motivation. And we're also aware that trans people, particularly trans women of color, are victims of murder, which is not included in this paper. Official systems that monitor violent deaths and hate crimes in the US are not adequately capturing data on gender identity, but we continue to push for better data collection in these systems like the National Violent Death Reporting System. And this is the contact information for the Williams Institute. I'm sure that will be readily available. And at this point, I'm going to send it over to Ericka.
Mute. Awesome. Great. Thanks. Yeah, thanks all for having me. This will be considerably less data heavy. So I wanted to provide some context to what folks have been talking about. Again, I'm Ericka. I use she, her pronouns, manager of training programs at the New York City Anti-Violence Project and with NCAVP. Just a little bit quickly about what NCAVP, the National Coalition of Anti-Violence Programs, does. We are a program of the New York City Anti-Violence Project. So we're housed here in New York. And we also now partner with the National Resource Center on Domestic Violence, NRCDV, lots of acronyms, to run the National LGBTQ Institute on Intimate Partner Violence. We are comprised of about 50 local anti-violence organizations who are members across the country. We have folks who are on like both coasts. We have folks who are in Kansas City. We have folks who are in New Mexico. We have folks who are doing a lot of different both like direct service work, folks who are doing more policy work on the local and federal level, folks who do training and capacity building. So it's a pretty diverse group of folks who are working all within the anti-violence field. We also offer training and technical assistance both to organizations that are by and for, so that are specifically LGBTQ and HIV affected led and for those communities. And we also offer training and technical assistance through the Institute to more mainstream domestic violence and sexual violence organizations, coalitions. And if folks are interested in either knowing more about NCAVP or more about the Institute, want more trainings, definitely feel free to reach out. Always excited to, to talk with more folks in the field. And then we also do policy and data and reports, which we'll go into a little bit more. So NCAVP does use data in the work that we do. The data that we use really focuses on individual incidents that are reported to anti-violence programs that then report to us. And historically, we've been doing these reports since 2000, wow, words, 1996. There we go. 1996. And we actually recently have been in a lot of discussions with folks both from Williams Institute and just in the field in general about how successful those reports have been. They've mainly been focusing on intimate partner violence, sexual violence, and hate violence. And the reports, we started writing them back in 1996 because there wasn't anyone talking about the high rates of intimate partner violence, high rates of sexual violence, high rates of hate violence that LGBTQ and HIV affected communities were experiencing. And really recognizing that now, 2021, for all the things that this year has already been, the reports have been really successful at highlighting how disproportionately high the rates of violence are against LGBTQ and HIV affected communities. And we also do a lot of media mining and looking at particularly the high rates of homicides of Black trans women. And in the last 2 years, we produced 2 kind of special reports. The first one was Pride and Pain, a snapshot of anti-LGBTQ hate and violence during Pride season, 2019. And both through incidences that were reported to us directly, as well as looking just at the media that was out there, we actually reported that there was an incidence of anti-LGBTQ hate or violence throughout. We kind of look at Pride season from being May 30th through, I think this survey was through July 30th. And there was an incidence of violence every single day. So that's huge and high. And then we also recently last year did a survey and report on how LGBTQ survivors of violence and the programs that work with them, how the pandemic was affecting how folks were accessing services and violence that folks were reporting, because we know that not everyone is safe at home, and that whole rhetoric of, stay home, stay safe, doesn't necessarily apply to LGBTQ and HIV affected folks, especially if they're in a violent household or in a non-affirming household. And we use data mainly for policy advocacy at the federal level with VAWA, the Violence Against Women Act, which hopefully will probably be reauthorized this year, and FIPSA, the Prevention Services Act. Oh, so many acronyms. So I want to include this slide, which really kind of gives an overview of why NCAVP and AVP really think that violence occurs, and how, why is it that LGBTQ and HIV affected individuals and communities experience high rates of violence? Why is it that, Black trans women are being murdered at unspeakably high rates? And really looking at the root of ideology and systemic oppression, and thinking about how those systems are working together to really manifest violence that was captured in the reports that y'all were detailing before, and really just wanted to kind of tease out also some of what that looks like. So I think that sometimes when we think about violence, especially in a lot of research terms, it can be a little bit narrow. So also thinking too about what are we maybe not capturing? How are we capturing the violence of poverty? How are we capturing school push out? How are we capturing medicalized violence for folks who are either being, intersex folks who might be forced to have surgery, or folks that are trans that are denied medical care, things like that. So what we really look at is how there are overlapping systems of oppression and how those are creating barriers for folks to live healthy, full, free lives. So there's some trends that NCAVP is like working with. We're again really exploring state level violence and systemic oppression as root causes of violence. And we're thinking about how do we like capture that in data, what sorts of data really will illustrate that for a larger audience. You know, looking at just the people that we work with here in community, being in community, really trying to center the experiences of Black trans women and femmes, and like really, you know, understanding that because they are the most impacted, they also like have the most brilliance at figuring out what the solution's going to be and how do we amplify voices of Black trans women who are doing the work and follow their lead. I'm excited about our community-based participatory research project that is both a partnership with the Institute as well as the Transgender Law Center and the Soros Foundation, where we are doing a community research project with queer and trans, Black, Indigenous, POC, disabled folks. And the entire research team, of which I'm part of the research team, we all identify as disabled, queer, trans, Black, Indigenous, POC survivors of violence. And we're really looking at what are the specific ways that disabled folks who are, a lot of disabled folks are queer and trans, what are their experiences with violence? How are folks surviving? How are folks reaching out to community? How are organizations equipped to work with disabled community? Really, again, kind of using a social justice, disability justice approach, looking at service provision. And then something that I think just this moment that has been for now years that we're in, we're really reckoning with what is our place in the anti-violence movement history, and how are we both documenting how the criminal legal system has really done so much harm and so much violence to a lot of folks in our community, and how do we as organizations support decriminalization efforts? How do we support decarceration efforts? How do we support these movements that are being led by folks in our community? And so doing a lot of reckoning with that, and a lot of just documenting ways that we've been intersecting with the carceral system, how that has played out for survivors. Again, like delving deeper into why folks aren't reporting, why they are reporting, things like that. And then, of course, we recognize that, you know, this pandemic is here. It's not going to go anywhere anytime soon, although, yay, people are getting vaccines. But, you know, just recognizing that the pandemic has added another layer of barriers and has really exacerbated existing inequalities and equities for particularly BIPOC, queer and trans folks. So really documenting ways that both that is hurt communities and also innovative ways that communities have responded. So just a kind of quick summary, bottom line, that systems of oppression are really the things that are creating conditions of violence that LGBTQ and HIV affected communities are experiencing. So it's not, you know, just that someone who is a sexual gender minority is more vulnerable. They're more vulnerable not because of their identity, but because of these systems that are impacting all of us. So that's it. Sorry if I talked too fast. And I'll pass it back to Ilan.
Thank you, Ericka. That was really a great context. As one of the participants already commented, and I agree, it's good to have this kind of broader understanding. And I have to say, when I first saw the data, the results, I was stunned, even though I knew to expect that, to see these huge differences and how they affect our community is really, well, I don't want to say shocking, but very, very dispiriting. I have a few questions, and thank you for the panelists for a great presentation. Lynn, I have a question to clarify something about the procedures for the survey, and that is, you said that participants are interviewed every 6 months, and the question is if they were from 2017, 2018, does that mean that they were interviewed 4 times? So a case that is included in the report is actually one occurrence in 2 years rather than 6 months. Can you explain that?
So, right, they are interviewed every 6 months, and then the way NCVS data are reported, they're aggregated to the year, and there's adjustments made to make sure we're not double counting people in the population. But when the questions, the sexual orientation and gender identity questions were initially introduced into the survey, they were asked in the first, third, fifth, and seventh interviews. So those questions were asked every other interview.
But the prevalence is a 6 months prevalence.
So we're talking about, just to clarify, we're talking about incident rates, not prevalence rates. Right. So it's an annual victimization rate. So the number of victimizations experienced by persons in the population during a 1-year period is what we're looking at. And then we've aggregated 2 years for the second paper.
Right, but regardless of the way they're asked, not regardless, but because of the way they're asked and the aggregation, they're still, even though it's 2 years aggregated, the results are still for a 1-year incidence.
So the 2017 data are for a 1-year period, and then the 2018 data are for a 1-year period. That's right.
Right. Andrew,
I hope I'm answering your question.
There's a question about how you handled the transgender people in your charts. Are they included, and is it based on sex assigned at birth?
To clarify that, so what we initially did is anyone who self-identified as transgender, we categorized as transgender, and then any respondent who reported a current gender identity that was different from their assigned sex at birth as also transgender. And then when we subdivide to transgender men versus transgender women, we look at the current gender identity. So when we say transgender men, it's individuals who we categorize as transgender and currently identify as a man. And when we say transgender women, it is individuals who we categorize as transgender and currently identify as a woman. And those individuals who do not identify with man or woman would be those who we just are non-binary. Though the non-binary was not an option in terms of like an explicit option in the survey.
Jody, there are a few questions about whether people are investigating. This is obviously, I think, obviously not in our survey, but there was a question about investigating the cases of 44 transgender people murdered in 2020. Obviously, we don't have data like that, but I wonder if you know more about anybody who's doing that, Jody.
Yeah, well, you are, and I am, and the team at USC are looking at the National Violent Death Reporting System. So one of the ways that data are reported for people who are victims of homicide is through the National Violent Death Reporting System. And just recently, they adopted sexual orientation and gender identity fields in their reporting system. However, we need to get death investigators to collect the data. And Ilan and I are currently involved in a study to figure out the best training for death investigators in order to collect that type of data. It's a bit more difficult collecting sexual orientation and gender identity data on somebody who is deceased. You have to investigate it in a completely different way. So we are working on that, but there are substantial gaps in the data, official data, on trans people who have been victims of homicide. NCAVP has done a lot of work gathering anecdotal data through various chapter organizations. Ericka could actually talk about that. So Ericka, do you want to talk a little bit about the data collection you do on this? It's not an official report through an official data collection system, but you all have devised a system that allows you to collect that data and compare it over time.
Yeah, so we get information from local chapters. So for example, there was a homicide in Chicago. And so we contacted our partner in Chicago, and they gave us as much information as they could. A lot of what we do is like support local chapters to have those conversations with their PDs, to have, we've been mediating between sometimes someone's chosen family comes into conflict with someone's given family. And so making sure people aren't dead named in the media, making sure people's like pronouns are correct. Sometimes like we won't even know that unfortunately like someone was murdered who was trans because like their pronouns were incorrect. So we've have an informal system of kind of trying to track all of that. I know that HRC also tracks homicides as well. So there's some of the ways we do it.
Thank you. There's a question, maybe Andrew, about geographic distribution of violence. And I think I know the answer, but let's see what you think about that. Obviously, we didn't present it.
Right.
Meaning among states or regions in the United States.
Right. I was actually typing the answer, so now I'm just going to say it. The public use file for the Ncbs, which is what we're analyzing right now, does not contain state or other smaller geographic indicators. But it does contain region by the census region, as well as an indicator of, say, urbanicity, so urban, suburban, and rural. And what we've preliminarily have found is that, interestingly, the victimization rates are higher for LGBT people in the West as compared to other regions. And when it comes specifically to hate crime, that rates of hate crime are higher in suburban areas than in urban or rural areas. I say these are preliminary because we are still working on those projects and still kind of ironing out our findings and results there. It is our goal as a kind of research agenda to gain access to the restricted Ncbs in order to be able to do some more finer grained geographic analyses. This is going to be limited, though, because of the changes that Lynn talked about by the Bureau of Justice Statistics in who gets asked their sexual orientation and gender identity. Because when it comes to geography, you can imagine that if you're looking at a smaller state, it's going to be, and you're trying to analyze LGBT people in that smaller state, the samples are going to get really small. And so we would need to pool many years of data in order to provide a robust analysis. As Lynn indicated, hopefully with changes in the leadership at the Bureau of Justice Statistics, we might see changes to the Ncbs that might allow us to do those kinds of analyses.
Thank you. And we're really out of time, but I'll let Lynn answer one more question. I think that's more like a crystal ball question. How likely is it that the administration, the Biden-Harris administration, would take back Trump's decision to limit NCBS data?
So to be clear, I don't think it made it all the way up the chain to Trump, but if I was a betting person, I would suspect that that would be a change that would be made pretty quickly to the survey to make sure that it goes back to the way the questions were intended and can capture the rich data that we know are needed to really understand the scope and magnitude of the problem and to be able to track the trends over time. So obviously I can't speak for whoever the incoming director is, but I suspect that's a change that'll be on the horizon.
Yeah, I mean, unfortunately, the new administration will have so many issues to deal with that not just the NCBS, but other changes during the Trump administration on the way the federal government handles many things related to LGBT people. I assume at least will take time. I'm sure there's the desire to do that, but it's a lot to do. We had some really fantastic questions, some of them really thoughtful, broader questions, and some of them much more specific questions about the handling of the data, and some of them about really what I would call future research. How do we move forward, understanding more about things like why are the LGBT people more likely to know their assailant and things like that. Unfortunately, we are out of time. We try to schedule these webinars so that they're not too exhausting. I know it's hard to listen and to look at all the data in a Zoom call, especially those of you on the East Coast. It's time to have dinner or go to bed if you're me. So I would like to thank again all the panelists. Those of you who didn't get their questions answered are welcome to send us an email and we'll try to address it. And I did share the link to the paper that Andrew presented. The paper that Jody presented is going to be published literally any day now on the American Journal of Public Health and will also be available on our website. There's a very easy search function on our website, so I invite you to look at that and see if you can find other information. If you want to contact Ericka, her email is edixon@avp.org. And the rest of us you can reach through the Williams Institute website and ask any questions. Thank you so much. And we will see you in our next presentation, hopefully soon. Have a good night, everybody.